The objectives for today's session, we always start with helping users help themselves. We'll be going into patient panel, some topics there, as well as searches and query, and then looking at recording information during the patient encounter. So just a couple tips on helping users help themselves. If you're not a regular Telin user yourself, but you're an improvement facilitator working with Telin clinics, there is a couple of places that you can go for information. One is the Telin knowledge base, and that's where they contain help files, and some of the useful help files that you'd find supporting ASAP are the help files on registration, charting, query, which includes some subfiles on query, quick report, and the search editor. Telin also has a number of videos on Telin Systems Ltd, and they're on YouTube, so anybody can access them. And some of them that you might find supportive are the ones on tasking, referral tracking, the encounter, and the patient chart. And those would be especially useful for people that don't use Telin on a daily basis. Another thing I wanted to pass on, just for your information, if you're not aware, Telin does offer something called a patient callback service. And thinking about how your organization is implementing outreach service, outreach screening, that might be a service that you just want to get more information on. And it's a way to contact patients to alert them about services related to a clinic. I certainly do know that they promote it for reminding patients about appointments, but clinics can think about other uses for that service, and it might relate to preventative screening. So the first thing we wanted to talk about is looking at the patient registration page in Telin. There are some important fields that you want to be aware of. What you see on the screen is the registration page, and you'll notice that there is a family doctor field and a physician field, and you can use both of these to attach the patient to the provider. But you should be aware of how you are using them as well, because that would impact your reporting, and Lori's going to talk about that in a minute. Ideally, for a patient that is attached to a provider, they should be the same. The other thing you'll notice in the family doctor field, they have that box called confirmed as family doctor. And there's a place where the date field automatically populates when it is checked off. Considering your panel processes as you're going through Alberta Screening and Prevention or panel identification for primary care network evolution, that little field will come in handy because you can run reports based on the data in that field. The other useful fields are, of course, the deceased field, and clinics want to have a good process for marking the patient record when a patient is deceased, and the inactive field, because that is where you will mark the charts of patients that are no longer in the clinic so that they won't show up in your reporting. The other useful field is type, and this Telin calls patient types. And this is a configurable field in that you can set patient types to belong in your clinic. In other EMRs, they often use a status field, but because Telin doesn't have a unique field for patient statuses, a clinic can use the type field to do this. The instructions are there, but also there is a useful help file in Telin for that, and you find that help file, it's called Registration Patient Types. So this is where some clinics are marking a type of field, for example, long-term care patients. They create a patient type for that type of patient. Or they might consider a patient that has not been in the clinic for 3 to 5 years to be lapsed, and they can create a lapsed patient type. But that's the option of the clinic, and that's another field that you can use when undergoing panel identification and management.
So, Barbara, I was just going to comment because I see on your slide as well that it's called patient types, and sometimes it's also called chart type. And I believe when we're doing the searches, and I'll talk about this, is that you're actually using the field chart type to search what's there.
That's right, Lori. And that's so the help file is called patient types. When you set it, and the instructions are on the screen, they call it chart types. So that's a really important point to be aware of. And yes, you can talk about that next. And this is a great segue. So Lori Choma is a top clinical process advisor in Calgary, and she's had quite a bit of experience in the clinic doing searches in Telin. And Lori's going to share that with us now. Thanks, Lori.
Great, thank you, Barb. So I'm just going to say a couple of things before I get started, and the first one is that I'm not a super user. I've been performing the role of improvement facilitator in a clinic who is on Telin. So, and I'm actually not even a super user. I'm actually not a user of Telin. I've gone in and I've really just strictly looked at it from the perspective of of just being able to do searches and pull information. So I apologize if there's language that I don't use, or if you have a question, I may not be able to answer it because really I'm in a little box with just doing searches. I also wanted to invite my colleague Liz, who is on the call and webinar with us today as well, who does work in this clinic. So I do invite her to jump in because we've been sitting side by side together, figuring a lot of this out. And the third thing I'll say is that we're not working on the most recent version of Telin, but my understanding is a lot of the information should be translatable, so we shouldn't see too much difference between versions. So I'm going to talk a little bit about panel searches, and then I'll talk about some of the screening searches as well. But your panel search processes are going to depend on what fields you're using in Telin. And Barb already introduced us to the physician field, noticing that there's 2 on Telin, and then if and how you're using that chart type or that patient type field. I'll get Barb to advance that. Okay. So if we're going to do a panel search, this is the way that we figured out how to do it. So from your main screen, you have the data option, and then from here you can select the query builder from the drop-down. And this is the screen that will show up. This is your query builder. And from here, we just went straight into using the search editor. And this is a screen that pops up for you, and this is where you can select the parameters for your search. Look at you to go to the next field. So one of the areas on the search editor is the available fields, and you have to scroll through these. Unfortunately, they're not in alphabetical order for us to go through. But a little tip and trick that we learned is if I just press, if I'm looking for deceased, I press the D, and it'll take me to all of the available fields that start with a D. So that was just a little, we were scrolling and scrolling and scrolling at the beginning to find the fields that we were looking for, but we found out that little trick. Because what we wanted to do off the bat is when we did our panel searches, we wanted to make sure that we didn't have any of the deceased or inactive patients. So for every search that we did, we needed to actually get rid of them. And so we selected deceased, and then we have said that that's equal to false, and then we add a line, and then we say inactive, and that's equal to false. And I'll show you on the next slide what that looks like. So on the left-hand side there, we would select inactive, and then in the comparison, we would select as equal to, and then at the bottom there, for us, it defaulted to false, but you just want to make sure that it says false. And then we added a line, and then we added in the deceased. So for the next line for our search, so now in our search, we have the deceased and the active um, excluded from the search that we're doing. We wanted to select which physician we had. So there's, again, as Barb mentioned, there's the two physician fields, and it depended on where you were consistently recording it. So you can see there's the family doctor option, and there's the physician option. And then, yes, thanks, Barb, for that. There's the, again, there's the two, the physician on the right-hand side, if that field is being used, and family doctor on the left-hand side. Next slide, please. So we, in the clinic that we're working in, they are using the family doctor field. They're actually using both fields at the current time because they had originally started just using the physician field, and that was something that they've been using for several years. And then they started actually doing the patient confirmation. So we decided to use that field here. And so what we decided to do was to actually, instead of choosing just the family doctors, we also used the family doctor confirmed date. And in the case of this clinic, that is greater or equal to December of 2013, because that's when this clinic started using that confirmation process on a consistent basis. So what we're running here, the panel that we're running here is the confirmed patient panel since December. So those are the parameters that we're looking at. So you would have to think about which fields you're using and what information you would want to pull to run that panel. But this was the decision that this clinic made.
Just a question, Laurie. So for the patients that are paneled, would the physician field and the family doctor field be the same for all those paneled patients?
It currently is not, or I should say it's pretty good in this clinic, but that's going to be clinic dependent.
Okay.
Next, I'll get you to the next slide. And then again, we've talked a couple of times about the chart type, and if you're using the chart type on the main demographic page. And just to note that, and just to reiterate what Barb said, is that drop-down list can be customized for the clinic. And this is where the clinic, and about the same time that we started using the verification or the confirmation field, we changed those fields to best reflect the different practices in the clinic. So it's under here, I believe we're using the term office patients here, but this is where we were able to identify the chart type.
Just a question, Laurie, just for example, what are some other examples of chart types that you've seen?
So in this clinic, there's some different consultation services that the physicians offer. So for one, we named the physician. So we have Dr. Doe consult, because he just does a specific type of consult. Some clinics do maternity care. So for 20 weeks plus, they'll take referrals from other clinics. Some do specific surgical procedures. So those are some of the special types. And then I guess Telin specifically has an inactivation, so we didn't need to do anything specific around that. But another interesting thing that this clinic came up with was the new patient concept, because they said what they would do is they would agree to take on a family member, for instance. So I'm a patient at this clinic, and then I say, well, will you take my husband on? And they say, their process was to say yes, and then enter that information so that at least the chart was started for when that patient did call in. What we found when we were doing some of the panel cleanup is that there were several patients who would just never come in. So the physician had agreed to see them, but then the patient never followed through on their end. So they decided to label that population new patients, and then when they actually booked in for an appointment, then they would be considered an office patient. So I thought that was a really interesting process as well.
Thanks, Laurie.
Okay, so at the end of it, this is what our panel search looked like. So we had the family doctor. So in this case, I used Dr. Doe as a sample physician, and we were also the physician was equal to zero. So we were actually in there searching the whole panel, but that wasn't something that's not something you necessarily need to put in. And then we used the deceased and inactive field, the date that the family doctor was confirmed. And then there you see the chart type. And yes, it is it's office patients that we are using in this clinic. And then once we had all of that information in, so the screen that you just saw was that top part of the search editor. And at the bottom, we just hit query. And from there, it produces our patient list. And so it produces the patient list, and it also gives you the figure. So if there's 1,000 patients on the list, it'll tell you that the search found is 1,000 patients. So if you're working on a panel cleanup and you're trying to capture that information on a run chart, and perhaps you want to get from 1,000 down to 900, that's something that you can track from day to day quite easily with Telin. So that was a nice feature that we saw.
And at this point, do you have the option to save this search?
You have we haven't done it, but I believe the option is there not to save the search, but you have the option to export the search. Is that what you were asking?
Yes, well, I'm looking at the save icon.
Okay, so this was a question that we asked Telin, is whether or not we could save it. And they said, unfortunately, this query with this many fields is pulling in this much information at this time cannot be saved. That functionality isn't there for something that's pulling from that many different tables.
Okay.
So no, unfortunately, we couldn't save the search. So when we go in, we have to recreate it. So if we want to run this search on a weekly basis to see what the panel looks like, we start it from scratch. But you get really good at it really quickly. So that is the panel search, and so now I'm going to take us through. I'm going to take us through detail. I think I picked the mammography search to take us through in a little bit more gory detail, and then I'll just show a few fields on how to do some of the other searches that we figured out. So we start the same way as we did for the panel search, using the data and pulling up the query builder from the drop-down menu. And there again, on the right-hand side is the same screen. But instead of going directly into the search editor this time, which is where we went for the panel, we actually start from this main patient tab. And so in the case of the mammogram search, we want to put in our age range. So in this case, we're using the age range of 50 to 69, and we're searching females. And by default, you'll see just to the right of the patient age and gender, those two checkboxes there are automatically checked, where they get included. Thanks, Barb. In the searches below. So here we used the physician number, and again, this depends on how you're conducting the search that you're doing. You may put in the physician number, or you may put in more detail in the search editor with the family physician confirmed and the date. In this case, just for ease, what we did is, because they're using both fields, is that we would actually put in the physician number. So if it was physician number 1, we would put it in, because what it does automatically is it narrows the search and just gives you that group of patients instead of finding the entire EMR. So that was just something, and we just thought that would be an easier process. So that was just something we decided to, a step that we put in. And then from there, we clicked New Search All Patients. So what that search does is it brings us all of the women age 50 to 69 attached to for example, physician number 1. And when we clicked new search all patients, right below there where you can, the table below there where you see the name, count, physician, etc., it actually provides you that list of patients. So we could actually see all of the women on that physician panel from 50 to 69 years old. And then just to refine it further, we then go in to use the search editor. So next slide, please. So we get back into the search editor, and so with the panel search, the same thing we needed to do again is to exclude the inactive and deceased patients. So it was the same process of saying deceased is equal to false. And again, we got the same, you could get the same thing by saying deceased is not equal to true. So there's different things you can play around with the information you get, but we found that the information was actually quite consistent when we tried it in different ways. That was really good to experience. And then this time, a little bit of a change. Instead of hitting query, we hit query in selection, because what it's doing is it's actually just querying this information from the selection on the first page. So it created that list of patients for us, and we're now actually taking just that list and excluding the inactive and deceased from that list. I'll get you to go to the next slide. Thanks. So again, at this step, this is where we talked about as a clinic whether we were going to look at the whole panel or just the validated patients. And because they were using both fields, they had just started confirming patients. That was a decision that this clinic needed to make. Your clinic may or may not need to do that. And that was just where we would go ahead and repeat some of that same information around the physician confirmation, the family doctor confirmation date. So that's just a consideration for your practice. Next slide, please. So we've had our patient list. So we now have our women 50 to 69, and we've got rid of those inactive and deceased. But of course, we want to refine it further and look at the ones that have a mammogram or who do not have a mammogram. So from there, we would automatically be on that patient tab, but you'll see across the top there's labs, meds, encounters, billings, appointments, history, reports, DI, diagnosis, PDI. So in the case of mammography, we went into reports and diagnostic imaging. So we picked that tab, and then we would go to the report date. Now, in the example here, we did a can you just head back there? We did a 2-year look back. So in the report date, we started searching from March 26, 2012. I probably did this on March 26th. Took this screenshot, and then we were looking for the report type of mammogram there. So it was available in the drop-down list. Can you go to the next slide, Barb?
There's just a question. We're going to go back to this slide because there was a question that so inactive is equal to false and deceased is equal to false. That means that on this screen you were looking for patients that were not inactive and not deceased. So the question came through. So it says false here, and it says false here. So that ensured that you were eliminating the inactive and the deceased patients. Oh,
yeah. So
we're gonna go. Sorry, we're gonna go back one more. I think maybe this one. No, there was another question. We'll get back to it at the end. Well, sorry, we'll move ahead again. Okay. Thanks, Lori.
Okay. So when we ran this mammography search, so there's 3 docs in this clinic, and when we were verifying the information, it was working well for 2 of the 3 docs. But the third physician, her mammogram weren't getting picked up in the search. So we were going through, we were finding a whole bunch that didn't, or that had a mammogram, but that weren't showing up properly early in the query. So when we talked to Telin about this, they very quickly figured out for us that there's something in the initial physician setup in Telin when they go in to say, this is how we're going to set up our screen, is that when they selected mammogram, it actually went in with mammogram space. So it was looking for this physician, something with mammogram space, not just mammogram. So we talked to Telin about it. They said a way around this is to use the @ symbol, which is the wildcard symbol. So in the search, instead of using the drop-down list, which was just searching for mammogram, not mammogram space, they suggested that we use mammo with the @ symbol. And then actually the search worked perfectly for us. We went through and verified several charts. If you want to actually back up one slide, Barb, you'll see there just above the mammogram field, and I kind of have it scratched out there with my red bar, is that there is that @ symbol. It does cue you there. So you can see the cursor there is right over top of mammogram. We had selected mammogram from the list, and then it populated the field to the right automatically with mammogram. But what we did, instead of selecting anything from that drop-down list, is we went in and said mammo @ and it pulled up the search correctly. So that was just a little nuance that we found, and they just recommended that if we ran into any issues, so if we were searching bone density or if we were searching for an X-ray, that we may want to use that wild card symbol. Thanks, Barb. I'll get you to advance a couple of, and one more. Okay, so we've put in the dates, and we've got the report type there. In this case, mammogram. And I apologize. I took the screenshots before we found out about that wild card, so I don't have it updated. So from there, we were only searching in the selection below, because on that first page we'd already started to narrow the search. So we've narrowed the search by female, by age, by physician, and then we went to the next search editor and we took out those deceased and inactive patients. So again, we're just continually narrowing the search. So that's the button that we use, the search only in selection below. And then from here you have two options, and those are on the right-hand side where it says patients. So you can select patients using the search below, which was giving us the parameters that we had put in. But you had the option as well to remove the patient. So what the first selecting the patients would give you all of the patients who fit the parameters that we put in. But what remove these patients would do is it would show you the opposite. So depending on what you want to get, selecting patients using the search below would show you all of the women who had their mammograms done, but clicking remove these patients would give you the list of all the women who were outstanding for their mammogram. So again, that's just something you would want to look at when you're doing depending on what you're trying to get. If you want to get both of those lists, and in our case, we were running both of those lists just to make sure we were getting the correct numbers, you have to actually start the search from the beginning again, because again, a search this complex won't save. So we needed to go back and we would run the search looking at the patient who had the test, and then we ran the opposite. And just at this last step, we would select to remove these patients instead of selecting these patients. Next slide. And so once we hit select patients, when you go back to the patient tab, that's actually where the patient list is. So the same thing we found on the panel is that's where we had to go back to that tab to get the list of patients. And again, it gives you the number of patients that you can see. If you have 300 women, 50 to 69 on your panel, you could get that denominator, and then from there you could look at showed up for the query. So it gives you the number and it provides you the patient list. And that is the mammography search. Pretty much the other searches all start out the same way. So if you're looking at whatever you're looking at, you would put in the age range. So if they're for the ASAP maneuvers specifically, we can put in the appropriate age range is found on the maneuvers menu. The gender that we're looking at, again, you have the option there to do both. And then you also have the physician number, if that's the field that you're choosing to use. And then from there, we would use the search editor again, so I just put that in, because we would want to eliminate the deceased and inactive patients. And the variations that come from using those tabs across the top, depending on what information you're trying to search. Let's go to the next slide. These are some of the examples we're searching for labs. So if you're searching for a PAP, the fasting glucose, the hemoglobin A1C, the cholesterol test, the FOBT or FIT test, which are all of the labs that are included in the ASAP maneuvers, we would go to that lab tab. Now from there's the lab test code, and depending on where you are in the province and where your lab is, that list will be a little bit different. When we went through, we found that we had a few duplicate tests. So because we're down in Calgary, as Calgary Lab Services would update a lab code, we still had some of the old ones in there. So when we searched fasting glucose, there were actually 3 options for it. So we were able to quickly figure out which one was the most recent. If you're doing a 3-year look back and it hasn't been 3 years since the code was checked, you may need to search more than one code in your search. But that was the way to get the test code. That might be something that Telin can quite quickly help you out with as well, so you know which code you need to use. So same principle as the other ones. We were putting in a lab test date, and in this case, I think I'm going to show you a PAP example, or maybe it was the fasting glucose. So it's a 3-year look back. Same step searching in the selection below, because again, we've eliminated the inactive and deceased, and we have the age range that we want. And then we go in to use the search editor. And next slide, please. I liked this feature in Telin, is that when we went into the query builder, I thought we were going to run into the same thing, but it actually knows what to look for because you're in a lab test, and it gives you things relevant from the lab table. So we selected the test code, and we said the test code is equal to, and then the value down there is the code that I talked about earlier. So I'm not going to remember what code that is, but we found the test code for the lab that we were looking for and entered that value in there, and then we asked it again to query and selection. I'll get you to go to the next slide. So I'm sorry, I didn't put the rest of the detail in, but then you go in and you decide whether or not you're going to select those patients, or if you want to get the list of patients who have not had the test done. So same thing with searching smoking and alcohol, same process with getting your age range, getting your exclusions. This time for smoking and alcohol, that information is found in the history tab. We did a 1-year look back in this case, such as we do for smoking and alcohol according to the maneuvers menu. And then we use the search editor. I'll go to the next slide. And so again, when we went into the search editor, it brings up all of the available fields that are relevant to history, because we're in the history tab. So in this case, we said smoking is equal to true, because we wanted to find those that had a smoking assessment on their chart. So we were able to find that information, and then we queried in selection. Same thing and same steps. So again, you do the same thing for alcohol. pressure, same thing, only it's found in these fields are found in the encounters tab. And then you can see the available fields there is weight, um, and the weight, and we just set it equal to 0. So we just wanted to have um, to know that there was a value in there. That was some direction that we needed to get from Telin. We struggled with how to get that information in, but we weren't looking for a specific weight. But if you were not doing an ASAP search, that you were actually looking for population over a certain weight, you could actually start to get that information too. So unfortunately, the search engine is not savable. That's probably the downfall, but there's so many fields, and the way the fields are so discrete in Telin, there's lots and lots of information that can be searched. But in this case, we were just looking to see that there was a value present, not an actual value. So we weren't looking for a certain height or certain weight or a certain value for blood pressure. And so again, that was circled there, but again, we would query in selection for this.
Great. Well, go ahead.
Is that it? I think, is that it for my slides?
That is, and we're going to,
okay.
Before we go on to looking at how we record screening, first, thanks a lot, Lori, from sharing your learnings there. And I know that you have the clinic on the line that participated in that is participating in this webinar. But does anybody want to add any learnings that they've had from using the search and query builder in Telin before we move on? Because we're going to talk about recording patient information.
Hi there, it's Diane from Calgary West Central PCN, and I have used Telin. I was a Telin user in the past. I would just say that because they're saying that you can't do the saving of the queries, that the person, when you want to replicate it, is very, very detailed in their notes to make sure that they are doing the exact same thing to get the same information or to repeat the query. That's the only thing that I find it a bit finicky, that you have to be really, really exact on your details.
Thanks, Diane. That's a really good tip. And you're right, because there are so many values that you're putting in and steps that you would probably either want to take your notes and write it out or create your screenshots so that somebody else could perform it, or you can repeat it exactly the next time. And you're right, you'd want to repeat it exactly for the next measure that you're doing for the next time interval. Thanks.
Yeah, and I know that for a long time they did have a problem with the BMI feature. And so, like you would have, I would suggest that you do maybe do a cleanup of that before. I'm sure that was a glitch that was in quite a long time ago. I'm sure that they fixed that, especially when I had talked to Kara at one of the Alberta Association of Clinic Managers conferences that they were looking at ASAP and being ready to support this initiative. So I'm sure that is cleaned up, but depending on how far back you want to go, you might find that it might not be accurate if you were going to try and go way back when, or didn't put an actual start date in that was fairly recent that you knew that it had been cleaned up.
Okay. Thanks, Dan. Was that in the last 3 years, or was it prior to 3 years ago, just by chance?
Yeah, it was in the last 3, probably at the very back end of that, 3 years ago, that they were having some challenges with that. And the other thing that we had found was that at one time the hemoglobin A1Cs had been assigned a different test number, and so sometimes it wasn't capturing. So just depending on how far back you were going, it wasn't capturing them all because it had been given, the number had changed for that test somewhere along the line. And again, that is probably fairly far back, and I don't think that anyone that is going to be using these queries at this point would be going back that far. Like all of Lori's demonstrations were fairly, I would call them fairly recent. So I don't think that it would be a problem, but if it was somebody that was, I would always suggest that somebody that's really familiar with the patient population does take a look at the list as they're creating did, because I found that even a person that I had at a clinic that had not been there for really that long a time was able to just give us a bit of a heads up and going, you know what, where is, Mr. So-and-so? He should have showed up on this list because he's a diabetic. And then it made us realize that we were missing a parameter. I think that the query features with Telin are excellent, but they are very, very detailed, and people have to remember they're only going to give you what you ask for, so make sure that you really 360 think how you're putting these queries in, because if you're missing something, just like Lori's saying with the deceased or the inactive, like if you're missing something that you really want, recognized, you do have to put it in, and that's why I'm saying when you're doing the query, just to, like Barb's suggestion of taking a screenshot of each thing that you're picking is an excellent idea, because otherwise it's so easy to just forget one little piece that all of a sudden you go, okay, what's going on? I've got such a different response from the last time I ran this last month.
Thanks, Diane. Yeah, those are some really good tips. And just an FYI for everybody on the line, in terms of test codes, so they have test codes in Telin, and they're based on the lab codes, but we've learned in all the EMRs across Alberta that when the lab codes change at the source, whether that be Calgary Lab Services or DKML in Edmonton, that does impact at the clinic level, and it's something to be vigilant in every EMR. You're going to find the lab codes changing, and you might be looking for two different words representing the same lab code historically. Thanks. And so thanks, Diane. Thanks, Lori. We'll move along because it's 8:15. We did want to speak a little bit about recording the encounter, and something that is unique to Telin is something called the POEM template, and it's based off the term proactive encounter maneuver, and it was created initially for the West Grove Medical Clinic in Spruce Grove, west of Edmonton, and you can access it from actually a number of ways, but one of the ways is when you do a new encounter and you see that POEM icon, you can click on it and it will pull up the POEM template. What you see on the screen is the old version, and we'll move along to the new version in a moment. But what the POEM template does is it was created so that there would be one place to record the screening maneuvers with a patient during an encounter. What it does do is it mines the data in the EMR and it looks for some lab values, and it will automatically pull that into the template, which is really nice. The other feature that you have in it, this one doesn't show any previous results, but this area, the POEM history, and this is where you see previous POEMs that have been completed on a patient. And a user can scroll through and see previous activities with the patient. We have June Cooper on the line. June Cooper is a clinical process analyst in Southern Alberta, and she worked with a clinic, and we have a couple of POEM templates from examples that are here, and we'll move to that. June, do you want to just speak a little bit about your experience with the POEM template? And I know the clinic's on the line too, but June, we'll go to you first.
Well, I haven't used it. I talked to the physician who helped to develop this newer version of it. You can see that discussed and declined or rec given is there, which of course is very useful, because if you tick it off, number one, if you discuss and give the rec for something and the patient isn't compliant, you can see by opening up the poem, that it was ordered, and then you could deal with why didn't you get the test done. You can actually then run searches to see for non-compliance, what your rate of non-compliance is. But even from a medical legal point of view, this actually validates that the physician did talk to the patient about that maneuver and or ordered it. And so if the patient didn't follow through, then the onus is on them for that. I believe Leah is on the phone, who is the gal doing a lot of the screening work at that clinic. But I don't know, have you done any work with the poem, Leah?
Hi, Karen. Yeah, we have worked quite a bit. That's one of the places I did most of the chart review out of. And we just had an improvement meeting actually on Tuesday and kind of reiterated to our team the importance of looking there and recording there. Dr. Michelle Warren has worked closely with Telin, getting some updates done within the poem just to make it a little bit more user-friendly from my perspective and from the physicians. Primarily the fit test. Right now you can see on the screen that's showing, it just has a little box for the maneuver date. And I know she's speaking with Telin to try and get it dropped down by occult blood 1, 2, and 3 and have those same boxes discussed, declined, and rec given. And even the capability of being able to click on the date and go in to view the results of the fit test. So that's hopefully going to come through with Telin. Another thing, too, with the poem is some of our physicians weren't finding it very user-friendly because they couldn't have it open at the same time as the encounter. So they didn't like having to close one screen to open the poem. It wouldn't allow that. Now we found out once we just had a look at it that Telin has updated that capability. So now we can have the poem and the encounter open simultaneously. So I'm hoping, fingers crossed, that that's going to increase our use from our physicians because it'll just be that much easier for them.
Excellent. And you know what I like about that is that they are working closely with the physicians that are using it and taking the feedback and actually tweaking it. We're ending up with a much more user-friendly product. And you hit the nail on the head. If they make it work within the physician's work style, they'll use it. And that's when we start getting the good data out, right?
Yeah, and the other one to keep your eye on too is the Framingham. Right now, in the poem, the Framingham, if you use it while you're in the poem, it will show you the score. However, it's not capturing it, so it's not staying attached to the poem version that you're in. So I know Dr. Warren was speaking with Telin on making sure that capture of the Framingham stays with that version of the poem so it can be referred back in the poem history as well.
Excellent.
That's really good to hear, Leah. Thanks for sharing that. And from what I understand as well, as clinics are being upgraded to the new release clinic by clinic, they will see the newest version of the poem as that takes place. So some clinics on the line might not have this available to them at the moment, but you can inquire based on when your next update is coming to the new release. Thanks so much, Leah. Do you have any other pearls of wisdom that you'd like to share about the poem template?
I don't know. It's just once you get your team to, have that buy-in that everyone looks for the same place, looks in the poem and goes in there to capture results and that sort of thing, it will be an invaluable tool for sure, and it is. Just a few little quirks, like with the fit test and the Framingham and that, but like I said, with Dr. Warren working with Telin already on that, I'm sure by long, before long, it'll be, very simple to use.
So from what I'm hearing you say too, it must become habit to use it because nothing's going to force a user to go there, but once they get there, it can become a very useful tool in the encounter.
Yeah, absolutely. And it's a reminder tool too, right? Rather than having a printout, say, of the maneuvers sitting on the desk or in the exam room, they're all right there. So they can just start at the top, whoever is rooming the patient can start, fill in as much as possible. And then the physicians, it's just a reminder that all these maneuvers need to be looked at or discussed. And yeah, I think the more we use it, the better it's going to be and the more efficient it's going to be for the physician visits with the patient.
Thanks, Leah. June, do you want to add anything at this point?
Well, it just occurred to me as Leah's saying that the forerunner to ASAP was a screening initiative that we developed years ago to be used during complete checkups. And we know that it actually makes almost a 20% improvement just having a checklist there to remind providers of screening that's due or overdue or questions they need to ask. So number one, by them making the fix so that you can have the encounter note open and this home template. And like Leah said, everything is there in front of you, so it reminds you, because the dates are filled in, you can see what's current and what's not. Again, that will make a huge improvement, almost the 20%. So it's funny how a lot of the pre-runner work we did to this, we're now starting to see, the EMR vendors putting things in place that help support everything that we learned.
Thanks, June. Yes, we know that checklists do work. So we are coming to the last 5 minutes. Do recognize that we have some experienced users on the webinar. That was the main information we wanted to share today, but if anyone on the webinar has any pearls of wisdom that they would like to share, this would be a great time to do that before we close off. So I'll give anybody on the line an opportunity to speak up.
Barb, did you have a question that you said we'd get back to, or was it answered?
It was about the, and Terry, you can say if we answered it or not, it was really about using the true and false in the search builder when you wanted to include or exclude information. But this has been recorded, and I'm pleased to say that we've got some pretty good quality. So we will be posting this up on the Toward Optimized Practice website. And you can refer to it later and or share the link with colleagues as well. So before we close off, do we have any questions? I will take it to say that then we're done then. So thank you, everyone. Oh, there is one question that just came in. See if we can get it. Okay, one question came in from a user, and the user noticed that the poem template can be quite slow to load during the patient encounter. And has anyone else, I'll ask, noticed this, or has anyone found a way to overcome it? And as no one's speaking up, I did have a discussion with another clinic using Telin, and they told me the same thing, that it can be quite slow. And I can imagine it would depend on the size of the database is one thing, and the number of maneuvers. So if it's looking in a larger database, and since the poem has increased in the number of maneuvers that it's looking for, it's taking time to search for that. So at this point, I am not aware of a way to overcome that, but if anybody does, we can report back to us and maybe inquire with the provider to see if they have any solutions. I have not heard of one at this point yet.
I think the most up-to-date version, I know we were just updated this week, and it does seem a little quicker. So I don't know if an update might help that issue.
Thank you. That's really good to know. So I hope it does make that difference.
You're welcome.
So it is approaching 3:30. So thank you, everybody, for tuning in. And we'll wish you a good afternoon. Thanks to questions or comments from the different clinics, and Lori for taking the time to show us all the documentation from preparing searches in Telin.
Thanks, everyone. Bye.
Good afternoon.
Barb.